Thank you so much, Dr. Iseko. I want to ask a question about the webinar. I think I attended like two of the webinars I learned a lot from the webinars. What feedback did you get did you get any form of feedback from the providers or doctors that attended the webinar? How the webinar impacted their
Okay,
lives. What was,
yes,
I
sorry,
don't know
I
if
was
you
able
got
to
a
unmute
feedback.
myself
What kind of
initially.
feedback? And if
Well,
you
the
got,
feedback was
what
quite
kind of
good.
feedback did you get from
A lot of
doctors?
we've had close to 350 doctors
Hello,
participating
Dr. Iseka, are you
across the
there?
country. Eventually, about 150 to 180 to 200 doctors attend each of the webinars. So that was quite significant. We had some of professors and consultants and different people from different areas joining up. So the feedback was very significant. Some of my teachers joined up, and we got a lot of positive feedback. A lot of doctors were happy at the approach and they were happy to get CME points. Some joined for CME points, some joined to learn. We had people join from outside the country, and we actually had exchange students come from outside the country to come and join us in our hospital because of those webinars. But about 180 plus doctors join us every week. Finally, we also had pharmaceutical companies come to partner with us to reach out to doctors and to explain certain concepts that they felt they could be that they will benefit in the end. For example, if we talk about pulmonary embolism, which was very high during COVID, of course, the pharmaceutical company that was selling anticoagulants wanted to be there, so stuff like that. So that was the kind of impact, and lots of emails telling us we were tired initially because we're not seeing anybody, but a lot of people kept on cheering us on. So we have kept that going for some time now.
Thank you so much, Dr. Iseko. So we are still on the team creating impact in chaos, health resilience lessons post COVID-19. And Dr. Iseko have told us how he was able to impact both the patient he's managing and his colleagues, and also made the hospital visible. They were still able to function. I never heard that Limi Hospital shut down during the pandemic. I never heard any bad outcomes from Limi Hospital. That was very nice, and that's why I am sure we heard what Dr. Iseko said, how he was able to contain whatever happened
Yes,
and how he
I'm
was
there.
able
Good
to function
afternoon.
even during the pandemic. Thank you, Dr. Iseko. So I will go over to
You are
Dr.
welcome.
Alabi. Hello, Dr. Alabi, are you there? Thank you. Thank you so much, Dr. Alabi, for honoring this invitation. So the question I want to ask Dr. Alabi, I know you must have experienced a lot of things. Like we said, it's a new normal. Nobody knew what was befalling us. We never knew what to do. So based
Thank you
on
very
what we have
much
seen so far
for
with
having
COVID,
me.
I
And I
know you
want
must have
to
experienced some
say good
things and you
afternoon
have
to
put
all
things
the
together. So what
listeners
I
and
just
those
want
that
to
are
ask
following
you now is
us
that what are you doing
on
to
this all the necessary one. We quickly
Hello, I think we've lost
reconstruct
Dr.
the
Alabi.
entrance to our former hospital, which is actually what we applied to the new place. PPPs, we get all the necessary one. And sanitizer to come in, and we, as much as possible, which is what we still do today, we will restrict visitors on our patients that are on admission. We make sure some maximum two coming to visit you. We make sure, and that is what we are still doing to date. We encourage patients who have access to the online platform for the hospital, use the phone call so that we can give you appointment and space the patient. Those that are not emergency, we try to space them so that we don't crowd our waiting room. Good enough, during the COVID, we were able to relocate to our permanent site, which is more spacious. And when we got there, we're still following comply with the protocol. We ensure that everybody followed the national protocol when you come to the hospital, to the premises of the hospital, right from the gate man, which is just like the new norm. From the gate man will take your temperature, ensure that you use your face mask, ensure you wash your hands, use your hand sanitizer before you come in. And we encourage all our doctors, nurses to follow the guideline. Treat every patient that comes as a case of suspected COVID. And in situations when we we are not too sure, for example, there have been instances that a patient come and during the peak of the COVID, and the temperature was 40 degrees centigrade. Just like what we made provision just at the entrance of the hospital, where the patient stay, and one of the doctor have to go and wear the PPS to go and take the sample. Because we're also conscious of the fact that not all high-grade fever will come out to be COVID. The patient cooperated, took the sample there, run the sample, find out that it was malaria, and she was properly managed. So up to date, what we should still encourage our patients to do is for them to book, and we can also commend our colleagues in THT in Abuja. Most of them are not. Once the patients are coming, they call so that we're able to make adequate preparation for the patient. And with it, to the glory of God, we've not had casualty, neither from the staff. And immediately the vaccine came, we ensured that all the staff of Excel got vaccinated. They got the 2 doses from AstraZeneca during the first batch, at least to protect ourselves. And as many patients as we are having contact with, we're also encouraging them, which is what we are doing today. We're encouraging everybody, go for vaccination, because that is the only way for now. So these are some of the things that we are doing. Thank you very much.
Thank you so much, Dr. Abraham. So I just noted some things you said. You said you were able to make provision immediately for hand sanitizers, and you took universal precautions, which is very good, because I don't think everybody, thank God, everybody is watching us here right now. Providers are watching. I love the fact that he made that statement following universal precaution, because some people will come to tell you that because there is COVID, I have to use this, I have to use it differently. I will ask them that according to WHO, everybody, every doctor, every facility is supposed to follow the normal universal precaution for prevention of diseases. If you see anybody, in fact, what I was taught, even right from medical school, was that every patient you see, at least HIV was one thing that was common then. Every patient you see that person as HIV patient until proven otherwise. And I followed that part. So whenever I see patients, the first thing that comes to my mind is that this patient is HIV positive. So I try as much as possible to protect myself and also the people around me, so that at least if eventually the patient becomes negative, that is okay. So that is also what healthcare providers, every one of us here, should do. See every patient, every person by your corner, every person at your side as COVID positive. By doing that, I think we also have to protect ourselves and also the people around us. Thank you so much, Dr. Okechukwu. And I also want to, Dr. Alabi. Another thing he said is he encouraged everyone to take vaccines, even the patients. So he did a form of health education. Health education is very, very important. It's the key thing in medical practice. He called the patients, please, you need to take this. He encouraged his staff, please, everybody need to take this to prevent, because we get a lot of information from
Thank
the
you very
social
much.
media. Even the doctors, medical practitioners go to social media that they download a whole lot of information that are scary, that wouldn't even make you to listen, to even understand what is happening. So Dr. Alabi has been able to educate people. Thank you, Dr. Alabi, for doing that. So I will still come back to you. Yeah, so we really appreciate that. It's very important. I'm sure healthcare providers are getting that. And also, another thing that struck me is that they are still doing it even before the third wave. Because some people, once I noticed that, immediately after we said the first wave left Nigeria, what people said, they came to tell me, some people, when you come say, even doctors, I have a doctor friend who is even a gynecologist. She said, she told me one day when there was COVID, I said, have COVID gone? She said, COVID have gone, no. So that's the idea, the mindset people in this, everyone, people have, majority of the people have. I'm sure I'm going to say 70% of everyone think COVID have gone till the third wave. Even talking about the third wave, a lot of people are still there doubting that there is nothing like COVID. Because, and you wouldn't blame them because of the way COVID came. So even when you think COVID is not in the country, there is nothing like COVID, but there is something killing people. That's what I tell myself. So even if it's not a virus, all I know is that something is killing somebody. So we all have to take precautions. Let us do the things that we can do by doing everything Dr. Alabi have listed here in our facilities. Apart from doing them in our facilities, we can also take them home, to our homes, teach people around us. We are medical people, we are medical practitioners. Tell them that COVID is real. Please, these are the things you do. So that's just what I just want to point out from what Dr. Alabi have said. Dr. Alabi, thank you very much. So I want to go over to Dr. Dominic Okechukwu. I don't know if he's still there. I think I got Dr.
Yes, I can hear you.
Okechukwu.
Please, can you hear me?
Hello, Dr. Dominic,
Okay,
are you
great.
here? Hello, Dr. Dominic. Thank you very much for joining this program. I really appreciate that. Can you hear me?
Yes, I can hear you.
Thank you, Dr. Dominic. I really appreciate your coming for. Yes, I can hear you very well.
Okay, great.
Thank you so much, Dr. Dominic. I know you must have fought this fight, because this pandemic is actually a fight. Like we talked about health security, and the second speaker today talked about securitization of health. It's very important. We don't really value health. We don't know that health is actually a security issue. And Prof have told us today that health is a security issue. So every one of us, each and every one of us, both the government and everybody, have to put all hands needs to be on deck to ensure that we're able to combat this security issue. Because even in this country, we are not prepared. I see the level of preparedness is not there. That's why when sometimes some things come, it just takes us unawares and we don't know what to do. So I know you have passed through this COVID period, because when Ebola came, it wasn't like it was that we had it the last time, because someone was able to save us. Let me use that word. Someone sacrificed her life for all of us. So right now that you have experienced COVID, because we don't know what else will come, I just want to know if you can tell us some of the resilience lessons you have learned as a medical practitioner, and what you think we can do about those lessons.
Okay, thank you so much.
Because I'm sure that you must have made some mistakes, or you must have
it's like
encountered some
any other
challenges.
disease we've
So what are the
had
things
before.
you think you must have learned?
You made mention
What are
of
the
the
resilient
HIV
lessons
when it came up. HIV
you must have learned
was
and want you
the
to share with us, Dr. Okechukwu?
Recording in
It's
progress.
just the intent, just like Dr. Alabi said, virus future. So it's something we have to live with. I kept encouraging my staff and the patient, as many as we here, to follow those precautions. And if they're able to, please, are you with me? Okay, that's fine. That if we're able to maintain that precaution, it will keep us from other infections, not just COVID. So the really lesson I will say is that let's one stick to the rule and follow the guiding principle that is behind management and prevention of every peculiar pandemic that will occur. Ebola was a unique one, and we battled over it. COVID came in, and it was as if that would be the end of the world. But I'm also having this feeling that more are going to come as time goes on, that the same principle that we adopt now, everybody should get used to that. We must get used to living with COVID. I want to say something about the vaccine. I spoke to so many people. I had to pull some of my friends. I have to insist, persuade them that they will take the vaccine. And I want to give a personal experience. There's this issue of churches and few other people that believe that vaccine is a device of the devil to depopulate the world and the rest. And it has no medical basis. It can be quite difficult when you have somebody who is very close to you also believing the same thing. As a doctor, as a married man, you're a physician and you're exposed in the hospital, you have your spouse that is working somewhere else, you take a vaccine and she does not take. You can imagine how it will be. I had to convince my wife at the time that, look, you have to take this vaccine. Everybody in the family, my mother-in-law, everybody that was staying in my house would take. My staff, we have to convince a whole lot of them. In fact, I wish it was easy to make it a compulsory thing. Quite a number of staff said no. They believe the other way, that look, that this vaccine is not tested, is the plan of the devil to depopulate the world, and they are not going to take. I kept convincing them. And I am so happy that on the long run, they listened to me. A whole lot of people took the vaccine, because I'm of this strong conviction that the way out of this pandemic is the vaccine, more importantly. Whether we believe it or not, we go to whatever you do in the hospital. The hospital is not an isolated environment, because we don't live in the hospital. We live outside the hospital. We come to work within the hospital premises. When you go outside and see what is going on in the markets, in the buses, and in the community, you realize that some of the protocol that we are doing in the hospital is more or less a formality. People leave the hospital and they go outside the hospital, they live as if nothing is happening. You go to the banks, they will stop you at the gate. You must put on your face mask. But you ask yourself, of the people that are wearing face masks, how many of them are really wearing face masks? A whole lot of them they are wearing mouth masks, not face masks. They don't cover their nose. They can't stay without breathing properly. So they put the face mask over their mouth. So I feel that vaccine is something that we must encourage. Now there's a provision for vaccine. Every health personnel must take the vaccine to protect other people, to protect the patient. We are so lucky that even in some cases, we have gotten some people that show some symptom of COVID. And in all those cases, we never had the cause of having any of our staff getting infected with COVID. And I must say also that in terms of general precaution, in terms of general preparation, I think we're still far behind. And why am I saying so? We had a lot of people making noise about donation for the COVID people. But where I am practicing, to get COVID tested, the level of demand they make on patients that you send for COVID testing, you now ask yourself, is this really a free testing or not? In the midst of the pandemic, when the lockdown was on, I remember most of the basic provision that are needed, providing a place for hand wash, providing sanitizer, wearing face masks, we're observing that, but it's just not enough.